Hi, and welcome. This is the fourth of 5 sessions where we talk about evidence-based practice. Today's lecture is called Apply, which is the fourth step in the process. My name is Sarah Villery. I'm part of your library instruction team here at Red Rocks. And before becoming a librarian, I actually worked for over 10 years in direct clinical care as a nurse practitioner. So here's our agenda for today. I'll first provide a recap of what we covered in session 3. Then we'll talk about that fourth step in the process, apply, including how to use the information you found to inform your decision making. And then finally, we'll talk about what's next. Again, we've talked about this every lecture, but the library is here to support you. We have an office here on the Arvada campus that's staffed 2 days a week, Wednesday and Thursday from 9 to 4. You can also book one-on-one appointments with us for research help. These can be in person or virtual. So go ahead and scan the QR code here to link you to that booking form. And I just want to take a moment again to put this lesson into context. Recall the 5 A's of the evidence-based practice process. So far, we have talked about the first 3 steps, ask, acquire, and appraise. And we are now on to the fourth step, apply, synthesizing the results with your clinical expertise and patient values. So in the last session, we talked about that third step in the process, critical appraisal. So during this step, we weeded through the evidence and determined which articles were the most valid, reliable, and relevant to your clinical question. We talked through 5 essential questions to help you get started, and we looked at several different critical appraisal checklists, which help you ask the right questions to really evaluate a study's worth and find the keepers, the keeper articles that you can use to move forward in the process. So now you have the strongest and most relevant research to your question. How can you actually apply the evidence that you found? So how can we connect this research to your practice? So this fourth step, apply, means integrating the evidence with clinical expertise and patient values and preferences to collaborate and make an informed care decision. Research alone is not sufficient to justify a change in practice. So, for example, say that a strong body of evidence shows that a specific injectable weight loss drug would be a beneficial treatment for your patient, but their insurance will not cover it, and the patient doesn't want to or cannot pay out of pocket. So then, despite the research and the evidence, this intervention would not and could not be part of your care plan because the patient can't afford it, right? So you would take that into account and you would adjust. You would come up with a different care plan. So that's what this step is about. Recall that in our very first lecture, we defined evidence-based medicine, which means creating a care plan based on 3 things: the best available evidence, meaning the research that you found in steps 2 and 3, clinical expertise, meaning a licensed practitioner's education, experience, and judgment, and individual patient preferences, so meaning that the patient has equal participation in the clinical decision. So this step, apply, is the process of bringing all 3 of these pieces together. And I found this quote, "Evidence does not make decisions, people do." So let's talk about the other 2 circles so that you and the patient are both empowered to use the evidence to make a decision. What does clinical expertise mean, that second circle? It means the ability to use clinical skills and past experiences to identify each patient's unique health state and diagnosis. So you are the subject matter expert. You know your patients, and this is extremely valued. You are bringing to the table your extensive education, your experience, your knowledge of the patient history and assessment, your interpretation of the laboratory data, your understanding of the risks and benefits of potential interventions, guidelines, and more. The patient is coming to you because you are a clinician and you have the expertise to help them make this decision. So this is what this means, using all of this information that you've gathered and that you're interpreting and explaining for the patient alongside what the evidence shows. And then what does that third circle mean? Patient values. So this means that every single patient will be unique and they will all have very unique needs. And these can be really difficult to predict and they should never be assumed by a provider. But the patient values are their understandings, their preferences, their concerns, their expectations, their life circumstances. So it's what they're coming to you with that they're using as a frame or lens to interact with the world with. So they are seeing the world and seeing these decisions and their healthcare in a really specific way because of the values that they bring to the table. So this can be, our hopes, our beliefs, our politics, religions, cultures, races and ethnicities, socioeconomic status, gender identities, sexual identities, our previous experiences in similar situations or different situations, the experiences that our family members have had, or friends or neighbors, observations as they see other people go through similar treatments and interventions. These are all going to affect the type of care that this individual in front of you wants to receive and how they're going to approach this decision-making problem. So when you're making an evidence-based care decision, you're considering all of these things so that the patient, the whole patient, is part of this process. Because ultimately, if your patient doesn't agree with the care plan, then they're not going to be empowered to follow through on the intervention. So you want them to be on the team as well. They need to have buy-in, and they need to feel like they're included in this process so that they feel empowered to then actually take the intervention and use it in their life. So when you're sitting down with your patient, some things to think about. Are the treatment benefits worth the potential risks and costs? So this is basically saying, will my patient be better off because of this test or treatment or whatever intervention you're considering? Every treatment has risks as well as benefits. We know this. And we also know that this varies depending on the individual patient. So for example, if your patient is a bedbound 95-year-old with advanced dementia and congestive heart failure, the benefits of a knee replacement surgery probably do not outweigh the risks, right? So is it really worth considering that as a viable option? It's something to think about and something that you and the patient need to discuss. Can this practice be implemented in this setting? And furthermore, would my patient be able to adhere to the intervention requirements? So if you're working in a rural hospital with limited resources and you have a patient who perhaps needs ECMO, which is a life support machine that takes over your heart and lung function, your hospital likely does not have one of these machines. So for you to formulate a care plan that relies on ECMO, which is not available, is not doing any service to your patient. So what other options do you have that can actually be implemented for this patient? Or for example, if you're treating an unhoused person and you prescribe a medication that requires refrigeration and your patient tells you that they don't have consistent access to a fridge, then if you continue to prescribe that, your patient may not actually be able to use that treatment under their specific life circumstance. And is that evidence-based practice, even if you know that that's the most effective treatment for your patient, it may not be the most effective treatment that your patient can have in their life, if that makes sense. Next, what are my patient's values and preferences? So we talked about this a little bit already, but what are their goals? What are their concerns for treatment? So maybe you have a commercial driver who's considering starting an anti-anxiety medication, but they don't want to take any meds that will make them feel drowsy because they won't be able to do their job. So you need to take their wishes into account when you're creating a care plan, and maybe that limits the different types of therapies that you can use. But you really need to think about that when you're coming up with your care plan. Finally, how can I help my patient make a decision? So think about their health literacy level. What is their primary language? How can I, as the clinician, provide clear and understandable information about their options? Are there any decisions or decision aids, excuse me, that would be helpful, such as videos or consumer health resources, maybe referrals to other team members, like a social worker, any written education sheets that you're aware of that could be helpful. So how can we help them feel like they're making an informed decision because they have all of the information, right? The medical language can be really hard for patients to understand, and especially if they're in a stressful situation, which a lot of times having a healthcare visit can be very stressful for people. So how can we make sure that they have all of the information in a language that they understand to be able to make a decision? And so as a team, provider and patient, we're making an informed decision together. So how can I make sure that they have all the information that they need to be part of this team? So now that we've asked the question, we found the research, we appraised it, and we applied it to our patient, what comes next? We just have one session left where we're going to talk about the fifth and final step in the process, assess. And that means how to evaluate your performance and the effectiveness of the intervention. So it will be available as a recording. And again, here is the link to the research guide. This has additional resources on the topic. In the apply section, I included links to practice scenarios where you can actually go through full cases and practice applying it to example patients. There's also a worksheet from Dartmouth Biomedical Libraries that can be really helpful as you apply evidence-based practice. And then I've also included additional resources on shared decision making. So on creating that team between you and the patient. Here is a reference. And we would love to hear feedback on today's session. Please consider filling out our feedback form. It's available here at the QR code or the URL listed here. And thank you for watching. Please reach out with any comments or questions, and you can also visit us in person at the Arvada or at the Lakewood Libraries. Thank you.